Catherine, firstly, let's start with the decision, no crowds for New Year's this week. Is that the right one?
Morning, Danica. Yes, look, unfortunately, I think it has to be this year. It's just too risky. We still have some cases, while they're all linked in the community to those Northern Beaches clusters, there are still some where they're not quite sure how the actual transfer of virus happens. So there might be some missed cases out there. And we do have a number of exposure sites, of course, right across Sydney. So I think it's sad, but it's much better to be safe and not bring, hundreds of thousands of people into the city, crushing on transport and so on. I think it's just something too risky this year.
How do you see the Northern Beaches cluster tracking? We are seeing lower case numbers, but also in the last 24 hours, a significant number of less testing. Is the state getting on top of it, do you think?
Look, all the signs are good. The cases are still linked to known cases. Many of the cases now are those people already in quarantine, which is really good news. That means for many of them, they were probably in quarantine even before they're infectious. So that really does start to really shut down this cluster. It's still, it's going to take time. There's still so many people in quarantine who could yet develop the virus, but there may still be some of these missed cases out there that are still waiting to be found. And we just hope that happens before they trigger too many more cases. So it's early days still. This has probably got a few weeks to go, but the fact the numbers aren't taking off and they're not seeing cases outside of the Northern Beaches with no links to Northern Beaches across Greater Sydney is a really good sign that this may have been contained to that area, but still some mopping up to do. And the testing is really important. Extraordinary numbers in the lead up to Christmas and on Christmas itself, but that has to be the way, because they're the eyes for the New South Wales Health. They're so critical. And I think anybody with symptoms, but also people who've been to those exposure sites, and if they tested negative in the first few days after being there, they possibly should consider going back for a second test as they come up to the end of that 14 days since they were at an exposure site, just to be sure.
At this stage, no source has been found for the original infection. Is it the case, Catherine Bennett, that an original source just may never be found?
Look, that is possible. They're still looking hard, though, and we've heard recently they're doing more serology testing. They've found people who are positive, who had symptoms that probably predate the Avalon RSL, going back to December 10 or so. So that might put them on the path that helps them through doing blood tests. These people won't be positive anymore, but at least tracking back and trying to understand, two things. One is how the virus got into the community. That's critical, so we know how to fix that, and so it doesn't happen again. But also to make sure there weren't any other sideways transmissions that were missed that might signal that there's still more virus out there. So it's important they do that follow-up work, but you're right, it might never be that we learn exactly how that virus got into the community.
There are still a couple of unlinked cases in the CBD, in Sydney's CBD. How worried should we be about this, that it just doesn't have a clear link to that Avalon cluster?
That is the worry, and it could be the tip of an iceberg. It could be that there's more cases out there. People might not even know. They might not have symptoms. They mightn't have been watching those exposure sites. And so those links back to known cases get broken quite easily. So it is a worry for the next while as we wait to see if any more cases emerge that start to both link to those and show that they are actually new clusters forming, but also going upstream, understanding how they might have eventually be able to trace these back to the Northern Beaches origins. So it is a worry because it means we haven't got all cases, and that's why the timing with New Year now is critical, and staying safe over New Year, making sure we don't make this worse than it is already, and leaving us in a really strong position to wrap this up over the first few weeks in the new year. That I think would be the best thing we could do for New Year.
Yeah, I'm sure that's what many of us are hoping for. Catherine Bennett, appreciate your time. Thank you for joining me this morning.
Thanks, Danica.